breast reduction, and she had a great result. She was very happy with the result. She did a lot, and she had a reduction with a lift. And she did everything I asked her to do, which is probably one of the first things I always look at, is to make sure that I'm talking to a patient who will listen to what I'm saying and understands everything. Because surgery is surgery. There's always pluses and minuses, but you can always limit the problems by doing everything your surgeon asks you, and you did them. I do all kinds of different surgery, from cosmetic to reconstructive. I do facelifts, breast surgeries, whether it's a reduction, a lift, an augmentation, a breast job, a boob job as they call it. Tummy tucks, liposuction. I do the Brazilian butt lift. I did my training at Harvard, but I went to Miami to learn how to do the butt lift. Yeah. And I brought back some of the things I learned and do it on a lot of patients here. So I also do thigh lifts and arm lifts, all kinds of different things, and all the Botox and fillers and
he can
things
lift you up, everything lift.
But I think every time, and we've talked about this a lot, you always ask what someone looks for in a plastic surgeon.
Yes.
I think it's important if someone has good experience, where they trained. I did my aesthetic, which is cosmetic, plastic surgery in practice now here in Boston. But it's not just someone's experience. You really have to have a good connection. I think those are words you use,
Yes.
And you have to have a rapport, you have to have a good trust, and because that just carries out or plays itself out post-operatively. And I mean, it was hard, but you did every single thing I asked you to do. I urge you to see a lot of doctors. If you're doing plastic surgery, see a lot of plastic surgeons. Yeah, because because they're interviewing you, but you're interviewing them. You really want to have a comfort there. I think that's very important. I encourage you, if you're going to come see me for something, go see whoever else you want to see, and just always have a connection.
I want to ask you, everybody asks me, Giovanni, what size are you? What size do you ask? And I ask for size sexy. So, but should it be up to the patient, to the client, to decide which size do they want, or should it be up to the doctor?
It's a combination.
I didn't want to make a mistake and say, oh, I want size B, and then you say...
Well, that's where the kind of the trust and the connection comes in. You want to have a connection with someone because they can really understand what it is that you want. It isn't just... we aren't just cookie cutters here. You want to have a certain breast size that suits your lifestyle. And how can you understand someone's lifestyle if you don't have a connection with them? So all those little things. That's why connection is important, not just for the comfort you feel, but also for the result. You want to optimize the result and have a great result.
Yes, everybody assumes that you lose sensitivity when you have the breast reduction. In my case, no.
If you think about it, you have a breast reduction and you had all this weight that was, kind of almost like putting all this pressure on the nerves, and all of a sudden this pressure is relieved, the weight is removed, and a lot of the times they become extremely sensitive. So that's
I'm very happy with that.
Additional benefit.
Yes, it's an awesome benefit. Ciao.
Thank you for watching. Bye. Anytime.
Y no te olvides, he's mine. He's my doctor, but I'm going to share him with you guys.